Time now for our rising crisis update. We'll begin with the number of coronavirus cases here in the United States and around the world. So here in the United States, we have approximately 2.1 million cases with an increase of 24,000 since yesterday. The number of deaths stands at 116,979 with an increase of 769 since yesterday. Then around the world, we stand at 8.1 million cases, an increase of about 100,000, 443,000 deaths, 423, with an increase of 6,271 deaths. Some troubling data, however, coming out of different states like Texas, where I believe they've seen a surge in hospitalizations overnight, and the governor of Texas there blaming younger Texans for not abiding by social distancing and wearing masks, predominantly 20-somethings. I believe it's the same case in the state of Florida, where the age of hospitalizations and of people testing positive is around the 37 mark. So it's younger people in reopened states that seem to be bearing the brunt of the new infections.
Yeah, I mean, I think it's ridiculous for the governor of Texas to blame young people when he's the one who set the policy to reopen the state. So I find that sort of ridiculous and unconscionable. At the same time, Vice President Mike Pence is out with an op-ed in the Wall Street Journal trying to spin these numbers as best he can. And basically, you know, the way you set that up is perfect, because at the national level, yes, if you look at the national top line numbers, number of infections are going down, number of deaths per day are going down. Those are all good things, although it seems that progress has somewhat plateaued and leveled out. But a lot of states are seeing spikes. 20 different states are seeing spikes. Many of those you can't just attribute to more testing, although there is more testing going on, which is a good thing. But in particular, Arizona, not only are they seeing inspections and deaths spike, but they're also seeing that ICU capacity starting to be overwhelmed. So while the vice president wants to call out the media saying that they're panicking over a second wave, he says such panic is overblown. The reality is, if you look state by state, some of the data is in fact troubling, and some of the data does indicate a second spike in certain states around the country.
Yeah, and of course, as we evaluate this, it's not just about reopening data. What we've talked about here is about the protests. I mean, there's going to be fallout that comes from that. And actually, Meghan McCain on The View talked a little bit just about how confusing it is for so many people to look and to take public health guidance about reopening and the way that the media covers that, and then the way that we just decide not to talk about it whenever it comes to the protests. Let's take a listen to what she said.
But we have to be consistent on this. And what we're seeing is a lot of anger festering up. When you're seeing people who are now taking it into their own hands and going and opening up playgrounds in Brooklyn because de Blasio won't let them. But at the same time, hundreds of thousands of people can go protest in Brooklyn. The messaging is very confusing for people. And we can laugh all we want on here, but this is the most angry I've seen a lot of people I know in the center and on the right, because the messaging is very confusing. Is COVID a pandemic that we all have to stay sheltering in place and inside, or is it not? Or is it only a pandemic if you are a conservative and you're a Trump supporter, and then you have to stay inside, and you're a hypocrite if you sign this waiver and you go into his rally, but you're not a hypocrite if you go protest someplace else? It's very confusing.
I think it's a valid point, which is that one of the things is, look, I mean, everybody wants to talk about reopening in Texas, going after the governor, Ron DeSantis and all that. Nobody wants. I mean, what about New York City? If we see a spike there, covered here yesterday, the city is literally telling contract tracers not to ask whether people have recently attended a demonstration to juke their stats.
Yeah.
I think that's unconscionable.
I think it's irresponsible. Absolutely. Yeah. Look, I support the right of people to go out on the street and protest.
We always have.
I support that.
Yeah.
I support people having the data and the information and making their decision about the appropriate level of risk for themselves, their family, and their community. That is different than trying to pretend like there's no risk over here, because there is. I mean, that's just, it's foolish to think that there's not. And when you're not even-handed, then that undermines your guidance on everything.
Exactly, which is that, look, let's say there is a horrible spike in Texas. What are people going to do? They're going to be like, you have to go back inside. They're like, we're not going back inside. Not after we saw millions of people charging the streets. We're not going to listen to you. And I don't think they should. And I wouldn't listen to them either. Same in Florida. I think that it's just making it to the point where public health authorities and the media have lost all their credibility whenever it comes to this, and we're all way worse off because of it. And that's truly something where I'm sure you feel the same way. I don't know what to believe whenever it comes to these things.
Yeah.
People are like, oh, coronavirus cases are up. I'm like, yeah, but there's not as much hospitalizations. There is in Arizona. The age is dropping. Is it bad? Is it good? I mean, it's just all of the amount of information that we're bombarded with and the way it's become a cultural issue is actually done a huge detriment to the way that we think about it.
Well, and when they started this whole thing by lying to everyone about masks.
Yeah, right.
It didn't set up a really great foundation for us to trust the information that we're getting going forward.
Yeah, exactly.
We're going to be back tomorrow for our latest crisis update. Please also like and share to help others find this video. Have a great day.